You had a particular point that you wanted to get across today in this roundtable discussion on healthcare with Congressman Cuellar, and you were saying that you're seeing a lot more patients. Tell us about that and what's causing that.
So we don't have a real good reason for what's causing it. We just seen a doubling in the number of patients we're seeing. I mean, these are the numbers we usually see in the height of winter flu outbreaks, and we haven't been seeing any big outbreaks of anything in particular, just the usual viral infections, but nothing to really justify doubling 20 and 30 patients a shift, which is really a significant amount. Usually the numbers ease up a little bit in the summers as people are away from each other and tend to do better. But we really are seeing a big doubling, and that's concerning. Hearing that there may be additional cuts coming, where people don't have insurance, they can't see the doctor, so they're going to seek in the emergency room. That's where they're going to be seeking their primary care.
You're expecting a
It's going to
lot.
get worse.
It's going to get worse.
It's going to get worse. Yes, most certainly. Yeah, especially if you're going to end up seeing more people utilizing our services. They're going to come to the emergency room. We already see it with the ambulances. We're one of the only ambulance services that's hospital-based in the whole valley. And you'll see people they don't have a ride. They literally call the ambulance simply because they don't have a ride or a way to get to the hospital.
And let's talk about this forum today, this roundtable discussion. How relevant was it for you? How important was it that the congressman asked you all to come in so that he could give you the latest update from Washington?
Well, it's always great to hear the truth, and besides the idiot bites that we usually get, again, reporters, you guys do the best you can, but you can only go off the information you're given. And so getting the insight as to what really goes on in the background is very important, because at least it helps us focus our energies on where we really need to be, who we need to be discussing these things with, and who we need to raise our concerns with.
Was there anything surprising that the congressman brought back from Washington when he explained the situation, or were you aware of all of this?
Unfortunately not. It's almost confirming our worst fears, realistically. And we know the border's always had, there's always been less attention paid to our border, except during election time. And then suddenly it's a big deal. But at the end of the day, we're one of the poorest areas in the country. We have one of the lowest socioeconomic rates. We have some of the highest rates of diabetes and other infectious diseases. A lot of this is genetic, but a lot of it is just because of the low socioeconomic standards, you don't have all the care that you would normally get.
The congressman gave us a handout today and gave one to everyone here from the Texas Hospital Association. They have their concerns. I'm sure the Texas Medical Association is concerned as well. Do you feel you're getting enough attention from those associations, from the Border Health Caucus, that they know the seriousness of the situation on the border?
Oh, unfortunately, we've been trumpeting this for years, and knowing that this is it's getting to a tipping point. This has been concerns we've raised for years, and our congressman has always been a willing ear to listen and has been fighting for us diligently. But one person, one voice, it's really hard against the avalanche of onslaught of negative voices from other areas.
And I asked Dr. Falcon this when he said, unfortunately, not enough people understand life on the border situation. And my question to him was, well, what if they don't care in Washington because they know the demographics, they know the percentage of undocumented immigrants that live here that he is treating, that you're treating, and they don't feel they should have health care? Why should they deserve health care? How do you respond to if that is the sentiment?
Yeah, I mean, at the end of the day, we hope they're all God-fearing individuals. We're all children of God, and these are our brothers and sisters. If you want to be pessimistic about that, then maybe that's not enough. If you have other people getting sick, they're going to get you sick too. So if you want to really bring it home to the most selfish person, if you want to stay well, let's get everybody else well and keep everybody in the best health. That's going to help us all.
Thank you for that, Javier. Jake, is there anything else you would like to add?
Yeah, we appreciate the media coverage. We appreciate all you guys do to try to get at the facts and really give us a voice. That's huge. Unfortunately, again, it's hard to extrapolate just a few sound bites, all the complicated issues. But, if we take care of each other and we take care of our people and our community, that's really going to help us all in the end.